the process of dying. People can face death in various ways, and how they cope psychologically depends on mga circumstances. Um, in later adulthood, Kubler-Ross introduced stages for coming to terms with one's death: denial, anger, bargaining, depression, and acceptance. While yung mga stages na to are crucial or important for understanding emotional reactions to death, it's important to note na the conditions of death dito ay nag-vary. So, not everyone goes through the stages in the same way. Confronting one's death. Alright. Think of facing death like parang journey siya or paglalakbay. Some people see it as a steps you go through, like stages. Pero yung iba, they look at it as a trajectory, which means the path from being healthy to the end. In some cases, like certain cancers or AIDS, it's a slow decline. Like, it gives you time to get used to the idea of dying and make plans. You might need to decide on treatments, thinking about the risks and chances of living longer. Pero sa iba kasi, death happens suddenly and unexpectedly. Like in accidents or heart attacks. Wala nang oras to slowly understand or prepare kasi it just happens. Facing the end of life can be a really tough or mahirap siya. It often comes with a lot of suffering or a high degree of suffering. Like nahihirapan kang huminga, trouble eating, being unable to move much, and experiencing pain. Yes, nakakatulong man ang mga gamot in some cases, pero there are situations where the suffering gets worse. Both healthcare providers and family members often feel unhappy with these tough conditions during a person's final moments, and afterwards for those who are left behind. It's a challenging and emotional time for everyone involved. The way we think about the dying process can change or pwede siyang mabago depending on the person's age. Different age group face different primary causes of death, creating a unique context of dying. To children and adolescents, accidents including things like injuries from fires, car accidents, or abuse are more likely to be the main cause of death. In middle adulthood, common causes of death includes cancer, heart disease, and AIDS, along with accidents and homicides. As people get older, the most likely causes of death are complications from chronic diseases such as heart disease, diabetes, pneumonia, or cancer. So depending on the age and circumstances surrounding dying process ay nag-vary or depende siya. The good death. Professionals caring for the dying are now defining what makes a good death or dying well. A British study group identified 12 principles of a good death. Number 1, knowing when death is coming and understanding what to expect. Retaining control over what happens. Being afforded dignity and privacy. Having control over pain, relief, and other symptom management. Having the choice and control over where death occurs, at home or elsewhere. Having access to necessary information and expertise, having access to spiritual or emotional support, having access to hospice care and in any location, not just in the hospital, having control over who is present during the end, being able to issue advanced directives to ensure wishes are respected, having time to say goodbye and control over the timing of other aspects, being able to live when it is time to go without prolonging life pointlessly. Itong principles na to, it emphasizes the importance of understanding, control, dignity, and support in the process of dying. So, yung mga tao, they have different views on what makes a good death. And these ideas change as someone gets closer to the end of their life. In a study, Widows and widowers were asked what they thought made their spouses' end of life experiences good. Here are some things they considered. Spouse was at peace with with the idea of dying. Spouse was aware of the impending death. Respondent and spouse discussed the death. Respondent was with spouse at the moment of death. Spouse led a full life. Spouse was not in pain. Spouse did not receive negligent care. These dimensions highlight yung mga iba-ibang aspects that individuals consider when reflecting on what is really a good death. It emphasizes the importance of peace, awareness, communication, presence, a full life, absence of pain, and quality care in shaping perceptions of a positive end of life experiences. There seem to be two ways to ensure a good death for people facing a slow, painful end. One is through hospice care, and the other is euthanasia. Hospice care is a way of taking care of people who are close to the end of their lives and their families. It brings together yung mga iba-ibang types of help like medicine, nursing, talking with someone, and spiritual support. The main goal is to make the person and their family's life as good as possible, reducing pain and helping with feelings while supporting the family through the dying process and the time after their loved one has passed away. This kind of care can happen in a special place for hospice or right at home. The Hospice Education Institute has these goals for giving really good end-of-life care, which is stated in the presentation. Hospice care brings several advantages for individuals facing a terminal illness. One significant benefit is that it parang gina-ensure na to that one has to go through the experience of dying alone, especially for those without family or friends nearby. Additionally, hospice care allows individuals to pass away in a more natural and familiar setting, such as their own home, as opposed to a hospital or nursing home. This setting kasi, it aims to provide a sense of comfort and ease. Beyond physical care, hospice also offers emotional and spiritual support, contributing to an overall better end-of-life experience for individuals in their final stages. Euthanasia. It means intentionally ending someone's life to ease their suffering. It's different from hospice care kasi hospice care focuses on comfort during the natural dying process. Euthanasia kasi, yung euthanasia is considered when pain relief doesn't work or when someone is being kept alive by machines in a vegetative state or in the final stages of a terminal illness. In euthanasia, the person has control over when their life ends. We have passive euthanasia. Imagine someone with Alzheimer's disease also have a cancer in the late stages. The question is, should we give treatments like surgery, chemotherapy, and radiation to prolong their life when they are already very sick? Passive euthanasia means not giving treatment or taking away things that keep them alive, like food and breathing. This makes the person pass away more quickly. Active euthanasia means doing things on purpose to end someone's life. One way is called mercy killing, where someone does something to make a person die on purpose, usually to stop their pain, but in our society kasi, this is like committing murder. Different places have different rules about whether the person who did it will be punished. For example, in Michigan, a nurse who made more than 20 patients die was found guilty of murder and got a life sentence. But in California, a wife who strangled her husband to end his suffering wasn't punished by the state. Physician-assisted suicide, or PAS, involves a doctor either giving a lethal dose of medication to a patient or helping them use a machine to do it themselves. This is a very debated and controversial practice. In 1994, Oregon made a law called the Death with Dignity Act, or ODDA, which lets terminally ill people in the state request a prescription for a lethal dose of medication from their doctor. The conditions are, according to the law, are stated in the presentation. So, ethical principles are about, we are now in the ethical issues at the end of life. So, ethical principles are about figuring out kung ano yung tama at mali, especially in moral and professional areas. When we talk about decision at the end of someone's life, parang similar lang to siya sa discussion na we had about abortion in chapter 4. These decisions aren't just for older people. They can come up with when parents need to decide on treatments for a very sick child, or when a family decides to stop life support for someone in a vegetative state. Sometimes a person might even consider yung assisted suicide to avoid becoming immobile or helpless. It gets complicated because deciding to end a life can go against the medical profession's commitment to keeping people alive. With new technologies and medicines, there are always new ways to slow down diseases or keeping someone alive even if they can't be cured. People have different opinions about whether doctors should help patients and their lives. In 2007, in a 2007 survey, about half said doctor-assisted suicide was okay lang, while the other half disagreed. But when asked if when someone is very sick and cannot be cured, doctors should be allowed to help end their life if the patient and family wants it, and about 71% said yes in 2007, a big increase from 37% in 1947. This shows that nowadays more people are open to doctors being involved in an end-of-life decisions, maybe because of better medical treatments. And with these improvements, it's important for individuals and their families to decide when to stop medical treatment. That is all po. Thank you.